Welcome to Bite-Sized Insights, a series of quick, live talks from a range of experts in data science and healthcare. All of these sessions were recorded live at HIMSS 2023. If you want access to the slides we used in this presentation, click the link in the description below.
My name is Jasmine Gee. I lead the marketing team here at Arcadia, and I'd like to introduce my partner in crime for the next 15 minutes or so, Dr. Rich Parker, who is our Chief Medical Officer and also a practicing physician. This is just going to be a conversation. Dr. Rich speaks to clinical leaders in our customer base, with our prospective customers, to clinical leadership here today. So, wanted to start off with a description of ChatGPT for those of you who have not been on planet Earth in the last 2 months or so. And I asked ChatGPT, who are you? Kind of weird, right? ChatGPT, wrote back, I am ChatGPT, a large language model developed by OpenAI. I am designed to assist with a wide range of tasks, from answering questions to generating creative content. I've been trained on a diverse range of texts and have learned to understand and generate natural language responses. And then I asked, who are you really? And then it got weird, so we're not going to go there. So, Dr. Rich, my first question to you, as you started hearing about this new technology, large language models, really cool demos, what did you think in terms of its applicability to healthcare today?
Right. So welcome, everybody. Really great to be here. Thanks, Jasmine. I looked at it with a mixture of skepticism and excitement. And I would say that historically, every advance in the history of medicine has been dealt with skepticism and excitement. I'll just give two examples historically. So I don't think any of you were around for bloodletting, but that used to be the way of dealing with a lot of illnesses. We'll just draw blood off you and see how you do. I think that was determined to be a pretty poor idea. More recently in my career, somebody came up with electronic prescribing of prescriptions, and that was initially met with skepticism and enthusiasm. Now all doctors do it. Nobody is sitting there writing 12 prescriptions on the renewal. So alas, with ChatGPT, we have a mixture of excitement and enthusiasm. My hunch is that it's here to stay. It's going to grow. We can't even foresee the many ways it will be used in medicine. Just briefly before we start our fun show, and we do have some patient examples for you all today that I think you're going to enjoy. I will predict that ChatGPT will take over a lot of the more mundane tasks in medicine. Some tasks are very important, such as the taking of the history. So we've all been patients at one time or another. You go to the doctor, you get asked a lot of questions. Maybe it's in the office, maybe it's in the ER. You're asked a lot of questions. Now, could ChatGPT ask you those questions? Yes, it could. And could it come up with what we call a differential diagnosis? Differential diagnosis is doctor speak for the list of possibilities of what maybe is wrong with you. Can ChatGPT do that? Oh, yes, it can. So we're going to spend a little time with you. We're going to have some fun showing you some real examples of how ChatGPT can and cannot work.
Great. And so here we are with our first example. Jasmine, follow instructions and don't get too close to the speaker. So while we were prepping for this, Dr. Rich thought of 3 clinical examples from real people and real kind of, thoughts that he had while he was working with these individuals. So here on the screen is at the very bottom, and I'm going to hit play, and Dr. Rich is just going to talk along.
I'll narrate a little bit as we go.
Here's an example of a tuberculosis example. So here we go.
We have to keep up with it. Okay, so a 45-year-old female with chest pain starting 2 days ago. It's in the center of the chest, quite severe, shortness of breath, coughing, and the patient coughed up a little blood. So here comes ChatGPT. It says, based on the symptoms, several potential causes of the chest pain, important to seek medical attention immediately. Some possible differential diagnoses. That's the phrase I just gave you. So here goes to the list: acute coronary syndrome, pulmonary embolism, so that's a blood clot to the lungs, pneumonia, we all know what that is, gastroesophageal reflux, so acid coming up from the stomach into the esophagus, pericarditis, which is inflammation of the lining of the heart, something that people don't always think about, aortic dissection, that is a life-threatening situation, which if not fixed immediately, usually results in death. And then, of course, ChatGPT says it's important to seek immediate medical attention if you experience chest pain, etc. So let's go on. Okay, so now I said the patient was traveling in Russia and Asia and was around a lot of people in different settings. So ChatGPT thought about that and came back and said, given the patient's recent travel history, it is important to consider infectious causes of the chest pain. And now it says, of course, COVID-19, very timely, tuberculosis, influenza, pneumonia, bronchitis, Middle East respiratory syndrome called MERS. Some of you may remember that one. And SARS, severe acute respiratory syndrome. And indeed, I had in my mind a person with tuberculosis who was coughing up blood. So it gave me the right answer at the end. That's pretty good.
So what did you think as you were going through this?
I thought this is a pretty good differential diagnosis. If I had presented this case to a medical student or a resident and I'd asked them to give me a differential diagnosis and they gave me the list that ChatGPT just did, I'd give them an A+. And that was really excellent.
All right, next example.
Okay, here we go. A 50-year-old, otherwise healthy man begins to realize that there are little bits of food or spit on his face. What could be the differential diagnosis for this? So this is a real case I'm giving you of somebody I took care of many years ago, but it's a very important case. So the symptom of not realizing that there are little bits of food or spit on the face is known as unawareness or neglect, typically associated with neurological disorders that affect the brain's ability to perceive. Differential diagnoses, there's that phrase again, may include stroke, traumatic brain injury, brain tumor, Alzheimer's disease, Parkinson's disease, and then this is very important. It wisely says other neurological conditions. So it's keeping the door open to other things to consider. So I went on to say the same patient begins having trouble with his gait, coughing, and is having trouble swallowing. So now ChatGPT says this combination of symptoms affecting motor and sensory could be Parkinson's disease, multisystem atrophy, amyotrophic lateral sclerosis, also known as ALS, Huntington's disease, stroke, myasthenia gravis. So pretty good. Now, okay, for 2 points, and I will buy lunch for anyone in this audience, even if you're a doctor, tell me what this patient has. Anybody? Anybody want to try? I'll make it dinner. Nobody? Any doctors? Raise your hand. Okay, so this is I'll give you the acronym, FOSMN. Any takers? Look it up real fast on your phone. Okay, time's up. No free lunch, no free dinner. Facial onset sensory motor neuropathy. I know that was on the tip of your tongue, right? It was on the tip of your tongue. Now, ChatGPT did not get that. That is a very rare diagnosis in a patient that I took care of. He died many years ago of this illness. It's like ALS, but it's not ALS. It is a neurological degenerative brain illness. Did we have one more, or those are the...
One more.
Oh, goody. This is so much fun. I'm having fun. I hope you are. I love doing this. Okay, here we go. Let's see what we've got. Okay, so you all knew that last one was Fosman. Okay, what do you do with a non-compliant diabetic person with out-of-control blood sugars? And it starts with education. The healthcare provider should first educate the patient on the importance of managing blood sugar levels, identify the cause of non-compliance. Okay, very good. Why is the patient acting that way? Simplify medication regimen. Very good. Regular follow-up. Good idea. Referral to a specialist. Good idea. Involve family and caregivers. Good idea. Consider mental health support. So very reasonable ChatGPT suggestions. If any of you in the audience are diabetic, you can weigh in, or anybody can weigh in. What are the options if a patient refuses to take insulin? So I'm getting a little ethical with ChatGPT now. If the patient refuses to take insulin, it can pose a significant challenge. Here we go. Education, identify the reason for refusal, alternative medications, lifestyle modifications, regular monitoring, referral to specialists, involvement of family and caregivers. Ultimately, the decision to take insulin lies with the patient. So that's the principle of autonomy in healthcare. And I'm going to make it a little harder. I'm going to say this patient refuses insulin or oral medication and does not care if they die as a result. What can we do? Okay, ChatGPT. So I'm making it tough now. So ChatGPT says counseling, family involvement, palliative care. Now that's the first time we've seen that one pop up. So it's getting really serious now where ChatGPT is thinking, or I don't know if it thinks, but it's inferring that if the patient is at the end of life, palliative care would be appropriate. And then interestingly, it says legal options. In some cases, healthcare providers may need to seek legal advice to determine the extent of their ability to intervene in the patient's care. And that is actually very important, very correct. I've been in that position many times in my career where I've had to speak with attorneys about what are the patient's rights, what are the family's rights, what are the interests of the state, how far do we go, do we need to have to get a judge to weigh in? There are a lot of issues. Is the patient competent? We could talk for another hour about what is the definition of competence, which I can share with you. So it says, finally, it is important to note that the options available may vary depending on the patient's specific circumstances, and healthcare providers should work with the patient to find a solution that is acceptable and effective for them. The healthcare team should also continue to monitor the patient's health and provide regular checkups to manage any complications that may arise. I find that last paragraph anodyne. We all know the word anodyne. Not terribly helpful, kind of generic, a little vanilla. There's no emotion coming out of that. It's just kind of straight text. So in summary of these three scenarios, which are all real patients that I have dealt with, I think ChatGPT did pretty darn well. It's not a doctor. We don't expect it to be a doctor. It's not a nurse. It's not a lot of things, but it's pretty darn smart. So let me pause there and let's take your questions and comments. Yes, John. Real loud. I can't hear it. What did he say?
How do you see nurses or other clinicians using ChatGPT in the clinical setting?
I think, we often talk in healthcare about getting clinicians to work at the top of their license. That is an aspirational statement that we'd like to make, and then we don't always make it. But I think that ChatGPT will help people ultimately work at the top of their license by taking some of the grunt work away and letting people do the harder, intelligent work that they need to do. So I'm optimistic, I'm bullish that ChatGPT is going to help clinicians rise to the top of their license.
And one question I have for you, because I'm cheating, because we talked about this, is we had a discussion around, ChatGPT's lack of creativity, right? It's, to a certain extent, the world's fanciest autocomplete. And what are your thoughts around, kind of the creativity that's necessary in healthcare dealing with people to, arrive at the right solution?
Right. So some of you may know I work in hospice on weekends, and I'm not afraid of being replaced by ChatGPT, because when I work in hospice, not only does it require me to have knowledge of patients' illnesses and what drugs do they need and what dosages. I think ChatGPT could do pretty well with that part. But I think the part that it can't do is being empathic, being caring, maybe loving to the family, to the dog that comes into the room with the family. Whatever the situation is, ChatGPT can't do that. It's not human. So I'm not worried about doctors and nurses being replaced by ChatGPT. I would worry about some other parts of the economy where that could be more of a problem. But I think on the creativity question, Jasmine, I think if you ask ChatGPT to write a Mozart sonata or a Bach prelude or a Chopin scherzo, it can't do it. It simply cannot. It can write something that sort of maybe sounds like it, but it can't. If you ask it to paint a Renoir, it can't. So I don't think we have to worry about having our spirit taken by ChatGPT. I think there's a lot more anxiety than is necessary because it's, as you said, it's an incredibly powerful autocomplete. Its ability to infer from data is remarkable. We were talking earlier how IBM created Big Blue many years ago. No chess player can beat Big Blue. That horse left the barn a long time ago. So ChatGPT is not stopping. It's going to still come on, and we have to learn to work with it, not against it. So other questions, or yeah, nice and loud so we can hear you. Best practice or yeah. So the question was best practice versus what's common. I think that ChatGPT is going to use the incredible database it has to infer. We're talking about healthcare here today, to infer what is the best practice, and it's going to try to get to best practice. Now, best practice is not always the same as most common, and I can tell you that a lot of times doctors do things that are common, but they're actually not best practice. So it may be that ChatGPT will show us both. It may say, here's what's commonly done, but this is actually the best practice. I would hope that it can do that. That's a very insightful question, and we'll have to test it. And it may get trained up to do that. Yeah, thank you. Yeah.
Question.
So you've talked a lot about how clinicians can use it to prompt and learn, but what about patients? Patients can put those same prompts in, and what does that do to the provider-patient relationship? You know, we already have people coming in educated because they've looked on WebMD,
yeah,
but now they might be more educated, or maybe it's more of a burden for
clinicians. I've always been, I practiced medicine for a very long time, internal medicine. I was always happy when patients looked stuff up and had ideas about it. And good, they're being advocates for their own health. That's great. And sometimes they thought of things that maybe I didn't. A lot of times they were wrong about stuff, but the reason they were coming to me is because they trusted me to help them figure it out. So I think that if patients look at ChatGPT and it says, maybe you have tuberculosis, and you walk into my office and say, Dr. Parker, I coughed up blood, and ChatGPT said, maybe I have tuberculosis. Yeah, maybe you saved me 15 minutes trying to figure it out. Oh, I think it's great. I'm not worried about I'm already worried about the doctor-patient relationship. That is a whole other conversation, which has many, many problems. I'm not worried that ChatGPT in and of itself is going to disrupt or worsen the patient-doctor relationship. I think we should do another session on technology in healthcare and the doctor-patient relationship, which is already very problematic. You know, when you go to the doctor's office and they're staring at a screen instead of looking in your face, that's a problem. So maybe ChatGPT will shorten the time that the doctor's looking at the screen. So that would be an upgrade. Yes.
So I'm a parent of a teenager, and my
congratulations.
Yes. My first thought is, you know, considering that we have this technology now, how do you think that's going to impact education for kids and also in medical school? Like, it's a shortcut, right? I mean, so is there any worry from you, you know, as a MD, long term, do you think that's going to kind of erode the amount of education or intelligence we have as humans, or are we just going to shift to kind of a different focus?
That's a wonderful question. So there are some people in this audience that are old enough to remember what was the Encyclopedia Britannica. Remember that set of books? Maybe your parents had it, and you'd go look in and you look at the pictures, and maybe you started at A and see how far you could get. All sorts of games you could play with it. Well, in its time, that was a big deal. Now we don't have people selling Encyclopedia Britannica. You walk around this place, nobody selling Encyclopedia Britannica. So I think that the revolution in education and medical education really needs to happen. We no longer need to stuff children's brains with data, with knowledge, because all they can do is look it up. So I think education is moving toward groups of people working together to solve problems. I think a lot of medical education is already moving in that direction, which I think is a good thing. I think you've all read about colleges dealing with ChatGPT, writing papers for the kids, and how do they deal with that? And some professors have welcomed it. Some are scared to death of it. Some of them make the kids sit in the classroom and write with pen and paper. So I think we're gonna work with and struggle with this new technology. But again, I'd like to say, I think we should embrace it and see what we can get from it rather than be scared of it, because it's not going back in the barn. And some of the leaders recently said, well, they want to pause on the development of ChatGPT. I mean, that's nonsense. This thing is rolling. So might as well just let it roll, and let's let's learn how to corral it and use it rather than be scared of it.
So I'm going to vote for evolution. Maybe you can argue with me as we wrap and, kind of join the happy hour. But again, thank you so much for joining us. And we're here to answer your questions or continue the conversation. Thanks so much.
Thank you, Jasmine. Thank you, everybody. Appreciate it.
Thanks for tuning in to Bite-Sized Insights. Please visit arcadia.io to explore more of these topics, or check out our other podcasts on data science and healthcare.